I'm your host, and today we're taking a journey through the labyrinth of American healthcare, a system that's as complex as it is costly and as frustrating as it is fascinating. Our guide for this exploration is the eye-opening book, Critical Condition: How Healthcare in America Became Big Business and Bad Medicine by Donald L. Bartlett and James B. Steele. So, grab a cup of coffee, settle in, and let's unravel the tangled web of healthcare in the United States. Picture this. You're standing in line at the supermarket, and you notice something strange. The person in front of you buys a box of Cheerios for $5.41. The next customer pays $6.76 for the same box. When it's your turn, the cashier scans your box. And the price? A whopping $29.92. Sounds absurd, right? But here's the kicker. This is exactly how healthcare works in America. Hospitals have a secret pricing system that would make your head spin. They charge different people wildly different amounts for the same services. A corporate executive might pay one price, while a self-employed individual or someone with a pre-existing condition could be charged 5, 10, even 20 times more. It's a system rigged against those who can least afford it. Over the past few decades, American healthcare has undergone a seismic shift. What was once a largely not-for-profit system has transformed into a profit-driven industry. Publicly traded corporations now dictate the terms of your healthcare. They decide which doctors you can see, what medications you can take, and whether you qualify for certain tests or treatments. This shift has had profound consequences. Patients face longer wait times for appointments, and their medical conditions are often evaluated by clerks with no medical training. Hospitals discharge patients before they're fully recovered, and the uninsured are left to fend for themselves. Let's talk numbers. 44 million Americans have no health insurance. That's more than the population of California and Texas combined. These are people who work hard but can't afford insurance, or who live in areas with no providers, or who are deemed too risky by insurers. But that's just the tip of the iceberg. Tens of millions more are underinsured. They have coverage, but it's so inadequate that a serious illness or injury could wipe them out financially. And then there are those who believe they have high-quality insurance, only to find out too late that it won't cover the costs of a debilitating disease or chronic condition. The human cost of this broken system is staggering. Every year, 18,000 Americans die because they lack health insurance. These are people who postpone treatment until it's too late, who can't afford life-saving medications, or who are forced to choose between paying for food and paying for medical care. And it's not just the uninsured who suffer. The stress of navigating this complex, often hostile system takes a toll on everyone. Patients and their families are left to battle with insurance companies over bills, spending countless hours on the phone and in appeals processes. The idea that the free market would solve the problems of American healthcare has been a colossal failure. The notion that competition would drive down costs and improve quality has been proven wrong time and again. Instead, we've ended up with a system that prioritizes profits over patients, where the goal is to sell more services, not necessarily better ones. The pharmaceutical industry is a prime example. Prescription drug prices in the U.S. are among the highest in the world, and the cost of medications continues to skyrocket. Drug companies spend billions on advertising and marketing, often promoting drugs for conditions they weren't originally intended to treat. Wall Street has played a significant role in the transformation of American healthcare. Investment bankers have fueled the rise of for-profit hospitals, physician practice management companies, and temporary staffing agencies. These financial maneuvers have led to a constant churn of mergers, acquisitions, and bankruptcies, leaving doctors, nurses, and patients in the lurch. The focus on short-term profits has led to cost-cutting measures that compromise patient care. Hospitals reduce staff, skimp on supplies, and cut corners on cleaning and maintenance. The result is a system that is often unsafe and unsanitary. The rise of call centers in healthcare is another symptom of the system's dysfunction. These centers, often staffed by low-paid workers with little medical training, are the gatekeepers of care. They decide whether you can see a specialist, get a referral, or receive certain treatments. The pressure to minimize call times and maximize efficiency often leads to rushed decisions and inadequate care. Patients are left feeling frustrated and unheard, while doctors are forced to spend valuable time navigating the bureaucratic maze. As if the system wasn't complicated enough, healthcare companies are increasingly outsourcing jobs to overseas call centers. Workers in India and other countries are trained to sound American, and they handle everything from claims processing to medical advice. While this may save money for insurers, it raises serious concerns about patient privacy and the quality of care. The distance and anonymity of offshore operations make it difficult to hold anyone accountable for mistakes or breaches of confidentiality. So, what's the solution? Many experts argue that a single-payer system is the way forward. This would involve a single agency collecting medical fees and paying out claims, eliminating the chaos and waste of the current system. A single-payer system would provide universal coverage, reduce administrative costs, and allow for better coordination of care. It would also give the government the power to negotiate drug prices and implement cost-saving measures. The American healthcare system is at a crossroads. The status quo is unsustainable, and the need for reform is urgent. As we grapple with these challenges, we must remember that healthcare is not just a commodity. It's a fundamental human right. Thank you for joining me on this episode of BrightLearn. I hope this discussion has given you a deeper understanding of the issues at stake and the potential paths forward. Until next time, stay curious and keep learning.
This has been a BrightLearn video from BrightLearn.ai on the book Critical Condition: How Healthcare in America Became Big Business and Bad Medicine by Donald L. Barlett and James B. Steele. Visit BrightLearn.ai for more fascinating videos like this one, and visit naturalnews.com for full editorial coverage and breaking news on critical stories that keep you informed and aware of what's really going on.